The current standard of care for patients with resectable pancreatic cancer is to have upfront surgery and then receive adjuvant chemotherapy. The Accord Prodige 24 PA6 trial, which was just recently published in New England Journal, suggested that the most effective adjuvant treatment is FOLFIRINOX for 6 months. So the current standard of care is surgery and then adjuvant FOLFIRINOX. A really nice abstract was just presented by a Japanese group looking at the concept of neoadjuvant treatment in resectable pancreatic cancer. There's a strong interest in moving forward with the idea of giving patients chemotherapy before surgery. We know that with this type of cancer, there's a high risk the cancer can metastasize early on, and it's a very large operation, resecting a pancreatic cancer mass. And because of that, there's really a strong interest in being able to give chemotherapy before surgery in this neoadjuvant type approach. This specifically was a study comparing neoadjuvant chemotherapy with gemcitabine and S1, which is a type of chemotherapy only available in Asia, versus upfront surgery and then adjuvant S1. And it demonstrated that there was a survival benefit to receiving neoadjuvant treatment compared to adjuvant treatment. So this study showed a survival benefit from the neoadjuvant approach, and the authors concluded that neoadjuvant treatment could now be considered a standard treatment for resectable pancreatic cancer. I think the discussant did a very nice job kind of putting these results into context, and I think again, this was using a chemo combination that's only available in Asia, and so this approach may be a standard in patients, in Japanese patients with resectable pancreatic cancer. But because it's a chemotherapy combination that is not typically used in Europe or North America, it's very hard to generalize that. So I think what this tells us is there's a kind of a strong interest in further studying this approach, and it really gives us more evidence to design trials comparing neoadjuvant chemotherapy versus adjuvant chemotherapy in resectable pancreatic cancer. There's a lot of controversy right now in terms of what's the best timing for chemotherapy in resectable pancreatic cancer, and there's a strong interest in giving it in the neoadjuvant setting. But I think the strongest data we have is the FOLFIRINOX data, which is all given in the adjuvant setting. And so because of that, it's really critical for us to do a neoadjuvant versus adjuvant trial to really demonstrate what the most effective treatment strategy is, using the type of chemotherapy that we use in North America and Europe. And so at the end of Dr. Ferroni's talk, she talked about the proposed trial that she's helping to lead, which is going to really look at that question of neoadjuvant versus adjuvant FOLFIRINOX.